Hello and welcome everyone. Thank you for joining today's presentation from the Health Connector, where we will present an overview of the Health Connector and resources available for those in need of health insurance coverage. Today's presentation is Health Insurance Options and Savings through the Health Connector, coverage for individuals, families, and small employers. We have a number of participants who have signed up, but we're going to go ahead and get started at noon today as scheduled. I'm Shaitra Sanders from the Massachusetts Health Connector. I will be facilitating today's session and also presenting a portion of it, covering information about the Health Connector for Business program towards the end of the presentation. I'm joined by my colleagues Nikki Conti and Melissa Montron, who will be presenting today's information, and we are here to help answer any questions you might have. I would like to take a moment to thank elected officials across the state for their support in promoting this webinar, including our partners in the state legislature and our congressional delegation. Before we get started, just some information about our presentation format. Everyone's audio has been muted and video has been disabled. The presentation portion will last approximately 30 minutes. Then we'll have time for a question and answer period at the end. If you would like to ask a question at any time during the presentation, please use the Q&A functionality. We will be monitoring your questions throughout. We ask that you please do not disclose any personal information or protected health information when you ask your questions, as others on the call are able to possibly see what you've written. If you have a particular personal scenario that you want to discuss with someone, we'll be providing contact information for the Health Connector's customer service centers and instructions on how to find help from a local navigator or a certified broker for the businesses. We are recording today's webinar. Following today's meeting, you'll receive an email with a presentation along with a brief survey about the information we've shared. So there's no need to take detailed notes. We'll also post the link to the survey towards the end of the hour. Please complete the survey if possible, as we'd appreciate your feedback on today's session, and your input will help us develop future presentations. So without further ado, let's go ahead and get started. Nikki?
Thanks, Shaitra, and thank you everyone for joining us this morning or this noon time. So as Shaitra said, the name of this presentation is Health Insurance Options and Savings through the Health Connector. And today we're going to talk about the coverage options for individuals, families, as well as small employers. So going on to the next slide, I'm going to provide an overview of the Health Connector organization and spend a little bit of time talking about the American Rescue Plan. My colleague Melissa is going to talk more about how individuals or families can get coverage. I'll share a little bit about getting help with this process. Shaitra, whom you just met, will talk about Health Connector for Business. We'll talk about key takeaways. We'll go through reminders because this is a lot of information. We want to be sure that you have what you need in order to get started. And we will also give you a very quick demo on how to get an estimate, and we'll see what we have time for. So certainly we want to give you at least one demo today. So moving ahead to the next slide, I'm happy to talk about the Health Connector. So we're hoping that some of you who are on the call, if not all of you are on the call, have heard of our organization. But if you haven't, we are the state's health insurance marketplace. And as I had said before, we're here to offer coverage for individuals, families, and small employers, essentially trying to provide access to affordable health insurance coverage. For those who don't get coverage through their job or other sources, a lot of people who apply through us qualify for help paying for their premiums. And also people can buy dental insurance through the Health Connector. So we spend a lot of time talking about health insurance, but it's also really important for us to acknowledge that people can also get dental coverage through us. The Health Connector for Business program that Shaitra is going to talk about is for small employers with 50 or fewer full-time employees. And again, you can offer that coverage, health and dental, to your employees through the Health Connector for Business program. So going on to the next slide, I'm not going to spend a ton of time on each of these, but just want to orient you a little bit to these topics, because as we go through the presentation, we'll talk about them in more detail. I think the most important piece of information on this slide is to acknowledge that all the plans sold through the Health Connector meet both state and federal standards for coverage. So whether you're an individual, family, or small employer, you don't need to worry that the plans don't meet coverage standards. Again, they meet both state and federal standards, and we offer quite comprehensive coverage. Now, starting from the left, we offer qualified health and dental plans. We have a variety of carriers that are available in each area of Massachusetts. And again, they're from leading insurance companies in Massachusetts. Typically what happens on the individual and family side, you enter information about where you live, your zip code, and you'll be able to see which plans are available near you. And Melissa will demo that for us later on. Now, in the middle of the slide and to the right, health plans with advanced premium tax credits, as well as connector care plans. These are really important concepts, and we'll spend time later on going into this in more detail. But at a minimum, I want to just convey that the health plans with advanced premium tax credits basically give people the opportunity to reduce the cost of their monthly premiums. And these advanced premium tax credits, or the additional advanced premium tax credits that are now available to folks, make it so that their annual cost of health coverage is not more than 8.5% of their income. And I know people might be wondering, okay, how do I figure this out? Not to worry, the system will calculate this as you are, when you enter information into it. And again, we'll talk more about this. Now, unique to Massachusetts, we have the Connector Care program, and people who are in lower income brackets who meet other eligibility requirements could qualify for these low or no cost health plans. So great coverage, consistent benefits across any carrier that you choose, and no deductibles in Connector Care. We also offer catastrophic plans available to those folks who are under 30 years of age or with a hardship exemption. With catastrophic plans, we do like to acknowledge or share a disclaimer that they might look appealing to folks because of the lower cost, but do realize that the lower monthly cost actually comes with higher deductibles and higher costs at point of service. But they are available for those who want or need them. On the dental plans, we offer this for individuals, families, children, small employers, and they include pediatric only plans and plans with lower or higher deductibles. And then Health Connector for Business. Shaisha will talk much more about this, but essentially we're able to offer the same qualified health and dental plans to small employers and their staff. Employers could qualify for tax credits, as well as a rebate, a rebate through the wellness program known as Connect Well. So going on to the next slide, just a little bit of information for you about the American Rescue Plan. Now, this was signed into law just March of this year, and it essentially makes financial help with health insurance available to more people across the country. So in Massachusetts, most people who already got help paying for insurance are now seeing even more savings. And a lot of people who didn't qualify for help before can now see lower monthly premiums. Now, if you go on to the next slide here, I'll tell you a little bit more about some other aspects of the American Rescue Plan. So you are probably grasping the idea that sure, there's more help, there are more dollars to reduce the costs of monthly premiums. And I want to talk a little bit more about that 8.5% of income. So in order to qualify for advanced premium tax credits, before there was an income limit. So now, instead of an income limit for financial help and advanced premium tax credits are going to be based on affordability. affordability, excuse me. So when you provide us with all of your information about your household, we're going to show you, or the system is going to show you, a set of plans that are available to you. And some of them will be no more than 8.5% of your income. Consumers can choose to enroll in other plans at higher costs, but at a minimum, you can feel comfortable knowing that you will see plans that are no more than 8.5% of your income. Now, there are a couple of other features of the American Rescue Plan that people benefited from this year. So people who got unemployment income at any point in 2021 have access or had access to low or no cost connector care coverage. And this was even if they wouldn't have qualified in the past before based on their household income. Now, it's important to note that this benefit ends at the end of the calendar year, so it ends on 12/31. Also, the American Rescue Plan included help paying for Cobra. So essentially, it made Cobra payments, or it made the monthly cost $0. So that was available from April through September of 2021. When this ended, people who chose to take Cobra really still had the option to enroll through the Health Connector. So we made sure that a special enrollment period was here for people so that they weren't missing out on coverage. So if you go on to the next slide. Okay, I talked a little bit about Cobra, losing help paying for Cobra being a qualifying event that lets somebody enroll outside of open enrollment period. I think Melissa is going to talk a little bit more about open enrollment, so you know what that is. But it's really important to note that all of these benefits that we're talking about through the American Rescue Plan are only available to people if they enroll through the Health Connector. And if you're wondering and you're thinking, okay, I maybe wasn't eligible for Health Connector savings before, could I be now? You can go to our website, our homepage at mahealthconnector.org, and there's a link there to get an estimate, or you can follow this direct link and you can enter some basic information and see whether or not you might be in a situation where you're now eligible for some savings. So going on to the next slide, I believe this is where I'm going to pass this over to my colleague, Melissa, and try to calm the puppy down. Thank you.
Thank you so much, Nikki, and good afternoon, everyone. So basically, I'm going to go over the overview of the Massachusetts Health Connector. So who can apply? So you should apply if you live in Massachusetts, are a U.S. citizen, U.S. national, or are otherwise lawfully present in the U.S., and if you don't have health insurance. You should not apply if you are enrolled in Medicare, Mass Health or Medicaid, or other public health coverage, are offered affordable comprehensive health insurance from an employer, or if you are in jail. So who can enroll? So open enrollment is a time when you can apply for new coverage for the coming year, or renew your coverage, or shop for a new plan. The Health Connector's open enrollment is from November 1st to January 23rd. During open enrollment, you can review the available health plan choices for coverage to begin on January 1st of 2022. If you need coverage sooner, apply right away to find out if you have a qualifying event that lets you enroll sooner with a special enrollment period. For all Health Connector plans, your health or dental coverage can start as early as the first day of the month after you enroll. Applying for coverage. So here's what to know. So there are 3 ways that you can apply for coverage. The first way is if you go online at mahealthconnector.org. And we also have a Spanish version, which is the mahealthconnector.org/ES/. The second way is by phone, and the third way is with the help of a partner community organization or health center. There is one application to find out if you qualify for coverage through Health Connector, including help paying for coverage or for coverage through Mass Health Medicaid. You will get letters from Health Connector and Mass Health that tell you your next steps. So what you need to apply is your Social Security numbers for everyone applying if they have one, immigration documents for all non-US citizens who are applying if they have one, and you can learn more about immigration documents in that link, immigration documents. You will also need pay information if you have it, such as copies of your last 2 pay stubs, your unemployment amount, which is the monetary determination if you are collecting unemployment, and information about your current income. If you don't have all the information above, give us what you have and we'll send you a letter asking for more information if we need it. So the application for individuals and families. So basically what you need to do is apply at mahealthconnector.org. And once again, we do have a Spanish version, which is the mahealthconnector.org/ES/. And again, there's only one application. So this is basically our homepage right here on the right. And where it says start your application for health coverage, you can click on apply now. But just real quick, we circled 2 things here. So basically, if you already have an account with us, you would just click on sign in. But if you don't have an account with us, you would just simply have to create an account, which is on the bottom of the page circled as well. So how do you enter income if you're unemployed? So when you complete an application, you'll be asked about your current income and your estimated income for the year. So what you want to do is enter your current income as it is right now, including unemployment income. Then enter your expected yearly income based on what you think you'll make over the course of the year. So when entering your yearly income, you also want to consider how much you earned so far this year. Add any unemployment, including any extra dollars per week you may be receiving. If you think you'll be returning to work later this year, include what you think you may have earned or you might earn. If your income changes later, update your income information so it is correct as possible. So now I'm going to pass this back to Nikki to continue with the presentation.
Thanks, Melissa, and thanks, everyone. So going on to the next slide here. At the beginning of the presentation, I talked a little bit about advanced premium tax credits and the Connector Care program. So now I just want to share a little bit more about that. So these are two ways people can get help. So those advanced premium tax credits, they lower the premium amount you would pay each month. And the way it works is that the IRS sends that tax credit directly to your insurance company. So it doesn't come to you, but basically you're going to pay less each month. Now, when Melissa was talking about entering your income and keeping it as accurate as possible, one of the reasons why that is so important is because based on all of that information that is shared with us, you're going to get a tax credit amount. Now, as a consumer, you get to apply the entire tax credit amount to your monthly premium payment or some of it or not all of it. And some people do that because they're thinking about their situation and they know that it might fluctuate. So they might choose to take only a portion of that tax credit. And then when it comes to tax at the end of the year, when you file your taxes for the last year, sometimes people get some tax credit back because they didn't use all of their tax credits during the year. So it is really up to you as a consumer. Now, the Connector Care program, again, I mentioned this was unique to Massachusetts. And the way it works is it uses those federal advanced premium tax credits plus dollars from the state. And those two together reduce the premium amount that you pay each month. Now, remember, I said Connector Care has low monthly premiums, low out-of-pocket costs, and no deductibles. So people, when you apply and you become eligible for the Connector Care program, the Connector Care program is organized by plan type. So depending on that, you could choose to enroll in a plan that's as low as $0 or even $133 a month. So we do have slides at the end of the presentation that will show you the benefit charts and more details. But again, it's a really great program, great benefits that are available here in Massachusetts. So going on to the next slide. Again, we're back to the income guidelines. What I want to do here is just point out that for the Connector Care program, there are income guidelines. So if you're looking at the chart, I just want to look at the bottom row here where it says the household size of 4. So in order to qualify for Connector Care, among meeting other eligibility requirements, someone needs to be making less than $78,600 with a family size of 4. So again, there are income requirements for the Connector Care program. Now, for advanced premium tax credits, just want to acknowledge that the 400% of the FPL, like those numbers, they're no longer relevant because the American Rescue Plan removed those income limits. So again, instead of an income limit, people are going to qualify for those advanced premium tax credits based on affordability. And when you see what you are determined eligible for, the results will show so that if you do in fact qualify for advanced premium tax credits, you can choose from plans that are no more than 8.5% of your income, or you can choose to buy up. So going on to the slide after, I'm going to talk to you a little bit more in this section about choosing a plan and enrolling. So here, the application process is one part, but once you do find out what you qualify for, the next thing you're going to need to do is shop for a plan and enroll in it. So before you applying, you might wonder, okay, which of these plans are in my area? Which of them cover my providers and medications? So we have a tool that is outside of your application called the Plan Comparison Tool. And if there's time today, I'll show you a quick demo of that tool. And then, as I mentioned before, if you're just trying to find out which carriers are in your area and if you could qualify for savings, we have the Get an Estimate tool, and that's the tool that Melissa is going to walk you through. So moving along, here, I just want to talk a little bit about how you can get some assistance. So there is free help available throughout Massachusetts. So you can get help at customer service. You can also get help through one of our community partner organizations. So the customer service number is listed here. It's 877-623-6765. We also have a TTY number for people who are deaf or hard of hearing. And in terms of our customer service center hours, days of operation, I'd encourage you to go to our website, mahealthconnector.org, where you can find information about call center hours and dates that they're open, especially during open enrollment. So right now, let's see, these links, that's what I wanted to point out to you. These links that are embedded in this presentation, Shaitra mentioned earlier that after this presentation's over, we'll send out the presentation so you have it, and you'll be able to click on all of these links. Now, on the right-hand side, we mentioned people who are known, our community partners who are known as trained and certified navigators or certified application counselors. Now, these are people who work community organizations. They tend to speak a variety of languages depending on the communities in which they're in, and they can help people with their application all the way through enrollment. So, especially right now during open enrollment, we would encourage you to call ahead and schedule an appointment for help. And again, you can go to our website and you can look to see where the free help is available near you if you want to make an appointment with someone. So on to the next slide. This is where my colleague Shaitra is going to jump in and talk about Health Connector for Business.
Thanks so much, Nikki. Nikki and Melissa spoke a little bit about where to get health insurance if you do not have access to employer-sponsored coverage or health insurance elsewhere. I'm going to talk to you a little bit about the Health Connector for Business, which is the platform designed for small businesses here in Massachusetts with 50 or fewer full-time equivalent employees that are looking for options to provide health insurance to their employees here in Massachusetts. So moving forward on the next slide, there are some key benefits of utilizing the Health Connector for Business as your marketplace to offer health insurance to your employees as a small business here in Massachusetts. What we here at the Health Connector goal to do is we seek to maximize access and affordability for small employers to offer health insurance to their employees. The way we do this is through flexibility, choice, and savings. As Nikki mentioned earlier, the Health Connector itself has access to all the leading carriers here in Massachusetts, and those leading carriers are also available on the Health Connector for Business. What we have found through employers who have been surveyed that have utilized the Health Connector for Business is employers tend to save on average at least 20% before any rebates by shopping through the Health Connector for Business. So there's savings involved, as well as money back. So our wellness rebate, which Nikki had mentioned earlier, is our Connect Well program. And the Connect Well program allows for employers who have employees enrolled through the Health Connector for Business to actually receive back about 15% of what they contributed towards their employees' premium contributions. We also have a very exclusive option that is called our employee choice model. And our employee choice model allows for employers to create a budget or a constant cost while providing their employees with the option to choose the plan that best fits their needs. So that's very exclusive to us, and I'll talk a little bit more in detail about that. We also at the Health Connector for Business provide free certified assistance to any small employer who's looking to enroll their group on the Health Connector for Business. We actually have over 460 certified brokers currently who are available to help employers decide which plan best suits their company's needs. Also, just to let you know, just like on the individual and family side, all plans that are offered through the Health Connector for Business do meet federal and state coverage requirements. So as I stated, we have a very exclusive option called the employee choice models that an employer can offer to their employees as a way of enrolling in health insurance. And those employee choice options are called one plan, one carrier, one level. I'll talk about it a little bit, but again, if you are interested in this and offering it to your employees, you can always call our customer service center or reach out to get help from a free certified broker. So one plan is where you, as the business owner or whoever the business owner is, would choose the carrier, the plan from the carrier, and how much you're contributing. So the employees would not have a choice in this selection. They would just be offered the plan that you are willing to put the budget into. But in one carrier and one level, that's a little different. So under one carrier, the employer or decision maker would actually choose which insurance carrier to offer all the employees. Then you would choose to contribute a certain percentage into one of the plans from that carrier, and that would be the plan that the business is responsible for. But the employees can go ahead and choose a benefit tier outside of that offer from the carrier and choose the one that best suits their needs and pay the difference outside the one that the business is paying into. One level is very similar to one carrier, but it just flipped a little. In this case, the business owner or the decision maker decides which benefit tier to provide to all the employees, chooses a contribution percentage that they'll pay into one of the plans from that tier, from a carrier, and then the employees are then allowed to shop across that benefit tier to any carrier and pay the difference outside of that, therefore allowing the employees to choose the carrier's plan that best suits their provider network needs. As I stated before, the Health Connector for Business does provide a wellness rebate program. It is called Connect Well, and businesses that qualify for this have 25 or fewer employees enrolled on the Health Connector for Business at initial enrollment. Employees get to choose from 30 qualifying wellness activities. They only have to successfully complete and upload one of those. The employer can receive back 15% of what they contributed towards the all employees premiums if they can get 1/3 of the employees who are enrolled to participate in one of those wellness activities. We found that the average Connect Well rebate for 2020 was about $2,900 back to an employer. It could be more or it could be less, just depending on how much you're contributing and how much the premiums add up to the contribution. Employees are also incentivized to participate in one of the wellness activities, and they could receive a $100 Visa gift card. So that's our Connect Well. There are also tax credit savings through the Health Connector for Business. The tax credit is the Small Business Healthcare Tax Credit. It is provided the information through the irs.gov website, which you can see here at the bottom, which is also a clickable link through our PowerPoint that we'll be sending later. The key is this tax credit is available to groups that offer health insurance on a state marketplace. And we are the Massachusetts small business state marketplace here in Massachusetts. So that is one of the qualifications to possibly get this tax credit of up to about 50% of the premium contribution. There are some other qualifications that the tax professional or accountant can look into, but the key is if you enroll on a state marketplace, this is something that you would want to bring up to your accountant if you are a small business owner offering health insurance through the Health Connector for Business. Now, I stated before, there are free certified assistance through our brokers, and I just want to let you know there are some benefits of utilizing a broker if you need help choosing a plan or choosing a plan option to offer your employees. One, again, they are free to utilize. There is no cost for any broker consultation or working with a broker on Health Connector for Business related items. Brokers can easily pull together cost estimates for different plans that are available to your business and create something for you, a proposal without you even creating a account until you're ready to. Just remember, brokers do this day in, day out. They are, I would say, very knowledgeable. They're the experts on what health insurance is and what is best for your business. So allow them to really put together something that works for you and your employees. And if you are a small business, obviously you are spending time on the goals of your own business. So take that opportunity to pass the health insurance part over to someone like a broker who can go ahead and create the plan for you, help you with enrollment. That way you can spend more time on what's important to your business. Again, if you are a small business owner and you're interested in, finding information about the Health Connector for Business, you can always come to our website, mahealthconnector.org/business. And I'll pass this back over to you, Nikki, to go over a few key takeaways and helpful resources.
Perfect. If you go on to the next slide, I will try to, let's see. So the first thing here is a reminder to all of you that we offer coverage for individuals, families, and small employers in Massachusetts. And what I was going to say is I'll try to make distinctions here because there are some reminders that are relevant for business. So Shaitra, please feel free to jump in if there's anything more you wanted to add. But with this presentation today, when you're looking at the second bullet, just be mindful that we're talking about the American Rescue Plan here, and we don't want to discourage anyone who might have applied before, because we'd like you to give the Get an Estimate tool a try to see whether or not you could now be eligible for more savings. Also, keep in mind that available through end of this year is help for people who got unemployment income at any point in 2021. Overall, again, not knowing where people are coming from, if you lose your employee coverage or you lose access to help paying for Cobra, both of those things are considered qualifying life events, and it's going to give you a special enrollment period to enroll in coverage through the Health Connector. So just wanted to say that anybody who's in one of those situations, please be sure to apply and compare your options through the Health Connector within 60 days of losing that coverage or within 60 days of that event. So on the next slide, you can apply for coverage online, over the phone, or with the help of an assister. This is the same thing for Health Connector for Business. You can apply online, over the phone, or instead of an assister, you will be getting help from a broker. Any one of these folks will be able to help you get across the finish line. Now, this next bullet is also true for individuals, families, as well as small businesses. You would need to, apply, complete your application, enroll, and if it's required that you pay a premium, you should pay that first premium by the 23rd of the month before coverage can start on the 1st of the following month. So in our case, or right now, you might be thinking about taking care of all of this by November 23rd, so your coverage can start December 1. Now, if you go through the application process and you can't shop for any reason, please do call our customer service center. They're there to help you. And again, you can get free help with applying and choosing a plan, not only through our customer service, but through our community partners, including our health insurance brokers. So call today to make an appointment for help. And I know we do have a couple of questions, but before we move on to questions, I'm wondering if Melissa, you wouldn't mind giving us a quick demo of that Get an Estimate tool?
Sure, definitely. I would love to. Thank you so much, Nikki. I'm just going to share my screen now. And I'm just going to bring you to our homepage, which you can go to by just entering the www.mahealthconnector.org. So from this page here, if you go on the top, Get an Estimate, you just hover over that, and then you just go to individuals and families and click on that there. Okay, so the page now brings you here to get an estimate. And I love this page because before applying, sometimes you can just basically come here and figure out how much you're going to save and what carriers are in your area. So if you scroll down, you want to pick your coverage year, which is 2021. And then just enter your zip code, and I'm going to give my zip code as an example. And then here you want to enter what you think your household income will be for the year. So I'm just going to make up an income. I'll just say 50,000 for the year. And then you want to enter people in your household, including people who may not need coverage. And so I'm just going to say that it's a couple, 2 people. And then here we want to enter the age of head of household, and I'll just say 32. And then person number 2 maybe is 34. And so here on the right, you also want to keep in mind this person needs coverage, or if this person is pregnant, or if this person is disabled or blind. So I'm going to say that both of them need coverage. And I'm going to click on Go to Results. And this here just tells you that this isn't an application for health coverage. So continue. Okay, so then we're brought into this page here, which is the estimated eligibility for this couple. So based on what you told us, your household may qualify for an advanced premium tax credit to help lower your monthly health insurance premium costs. So that maximum tax credit is $445. And then it tells you here, you are eligible for silver plans with monthly premium as low as $213.21. So that would be your savings. And then it tells you here for each household member, the potential eligibility. And then we can scroll down and we can take a look and preview plans for this couple. So here is the estimating savings details. So basically, it's telling you here that the monthly advanced premium tax credit for this tax household would be $445. Those are the savings per month that you would be getting for this couple. And then if you continue to scroll down, we have categories here. So the first one is the carrier in the area, the plan name, the coverage level, the monthly premium, but then the advanced premium tax credit savings. And then we have the Massachusetts state savings and what you would pay monthly. So this is basically an overview of everything that, you know, your savings, the carriers that are in network in your area. So it's just a great tool to figure out what you would be eligible for before even starting the application. So I'm going to bring it back now to Nikki.
Don't go too far, Melissa. We'll keep you too for questions.
Okay.
And Nikki, if you want to do a quick demo, I think we do have time.
Okay, I'm happy to do that. So folks, you know, I had mentioned that Melissa was showing you the Get an Estimate tool. I'm going to quickly show you another tool from our website. So remember, she went to this area up here, Get an Estimate, and she selected individuals and families. I'm going to actually go to the column that says Help Center, and I'm going to slide down and I'm going to choose Resource Download Center. Okay, so in the presentation, I mentioned that, you know, you could use the Get an Estimate tool to figure out what plans are available in your area, how much they cost. But let's say you got that information and then you were wondering, okay, but of those plans that are available near me, will I be able to keep my providers? Will I be able to go to, let's say, the community health center I want to go to? Like, how is this going to work? So this plan comparison tool lets you kind of look into the plan a little bit deeper. So here, I'm just going to plug in 02113. And the last example Melissa gave you, the couple did qualify for connector care, and I'm just going to say plan type 3. You can also, of course, you know, say no, you're not sure, or no, not at all. So let's just see if this will go. Just going to give it a little time. All right, in here, I need to enter the name of the doctor. So I'm going to say this primary care doctor is someone I want to be sure to include. So I'm choosing my doctor. And I mentioned a health center. So let's say I want to find out about the North End Health Center. And here, let's say I want to find out about this medication. All right. So in my area, it looks like there are 3 options for a connector care member who's plan type 3. So Always Health Partners, BMC Health Net Plan, as well as Tufts Health Direct. Over here, you'll see that all of them do have my medication. All of them, my provider looks like it would be accepted by any one of those. But in terms of the facility, it looks like the only carrier that covers that facility is Always. So these are the types of things that you can keep in mind. So I hope that was helpful. And before I think I need to pass it back to Shaitra actually, so that you can, perfect. Thanks so much, Shaitra. We can go right into questions.
Thank you, Nikki. And I want to say that was two great demos that you and Melissa just showed. So thank you so much for that. We did have a few questions. Let's go through them. And okay, well, the first question actually, I think I will be able to answer. It is for a small group. And a small employer would like to know, are the brokers licensed to tell consumers about all the plans? Well, on the Health Connector for Business, I want to let you know that the brokers are all who are on the Health Connector for Business are all certified to tell you about the plans that are on the Health Connector for Business. So any broker that you get through the Health Connector for Business can explain to you about the plans available through the Health Connector for Business and help you enroll your group in any of those plans. There was a follow-up question to that. What are options for employers with more than 50 full-time equivalent employees, and can they use the Health Connector for Business? So at initial enrollment, if your group is larger than 50 full-time equivalent employees, you would not be able to use the Health Connector for Business because you would not be considered a small business owner. You would have to go through the private market, such as going straight to the carrier and looking into plans through them. Brokers themselves can assist you with those enrollment and purchases also. So I hope that answers some of the small group questions there.
And Shaitra,
yes.
before you go on to another question, I just wanted to offer some clarification though, because we were talking about brokers, and then when I was going through the reminders, I was merging information. I want to be sure that people know that if you are shopping as an individual or a family, you would not go through a broker in Massachusetts. I know it varies in other states across the country, but in Massachusetts, you would not be going to a broker for individual or family coverage. You could come directly to healthconnector.org, mahealthconnector.org, our customer service, or to one of our certified assisters. So I just wanted to offer that little tidbit.
Right. And exactly opposite. If you are a small business and you are looking to offer health insurance through the Health Connector, you would go to a broker and not through a navigator or a certified application counselor. So thank you for that clarification, Nikki. There are some questions on eligibility that I'm going to shoot yours and Melissa's way. If I don't qualify for Mass Health, can I still get coverage through the connector?
Sure, that's a really, really great question. So let me back it up a little bit and say that when somebody applies through mahealthconnector.org, they're applying, there's one application for both the Health Connector and Mass Health. I think both Melissa and I mentioned this. So if you're going through and it turns out you don't qualify for Mass Health, you may find that you are eligible for a Health Connector plan instead. You get notices from both Mass Health and the Health Connector. And if you don't qualify for savings, you could potentially shop for coverage without any subsidies. So you'd have the ability to shop through and look at our commercial plan offerings without any subsidies or savings attached to them. But it is still a great opportunity to do that, so that you can compare the health insurance plans, kind of do an apples to apples comparison, and make the choice or choose the health plan that's best for you.
Thank you, Nikki. Here's one that comes up often. I have employer-sponsored insurance, but it is too expensive. Can I enroll through the Health Connector's individual and family coverage?
Sure. So let me start with that one, and then if anyone else on the team wants to add in, please feel free. So in terms of the, the concept of affordability or access to coverage, I think it's important for people to know that when you're going through the application process, you're asked about your access to health insurance coverage. So you need to let us know if you or your spouse, your partner has access to health insurance coverage that could cover you or them. And then you're asked some questions about the contribution, the employer's contribution to that coverage, as well as your contribution to that coverage. Now, it doesn't go into details regarding, let's say, the cost sharing. So we don't go into, what the doctor's visits cost or the medication costs, but we do need to know about the monthly premium and how much you're expected to contribute and the employer contributes. All of that information is taken into consideration. A calculation is done on the back end, and based on that, essentially we look to see whether or not that plan is affordable based on state affordability standards. So I hope that helped. And again, I welcome any team members. If there's anything you want to clarify, please don't hesitate, or say in another way, because sometimes that's a hard question for people to wrap their minds around, or hard answer for people to wrap their minds around.
I think that was great, Nikki. This is Kayla with the Health Connector. I wouldn't add anything new. Another way I think about this sometimes, if this is a helpful way to frame it, is that even if your employer coverage doesn't seem affordable to you, I wouldn't assume anything, or if it does seem affordable, I would just put that information in and then that calculation will be done. So yeah, I would just go to the application.
Okay, great. Thank you so much.
Thank you both. Well, so here's a great question. As a small business owner who does not have employees, what type of proof of income should be provided for individual coverage? So I would like to just state this is a great question, because small business owners who do not have employees cannot enroll through the Health Connector for Business. I just wanted to clarify it. For a small business owner to enroll through the Health Connector for Business, they have to have at least one non-owner enroll with them. But as Nikki and I like to point out, that doesn't stop you offering health insurance to yourself as a small business owner through the Health Connector. And that would be on the individual side, that you as a small business owner only could buy health insurance. So Nikki, could you talk a little bit about that, and what kind of proof of income would they need as a small business owner?
Sure. So for small business owners, we would need, and I'm going to stumble a little bit, I'm going to ask my colleagues here for the name of it, because it's just like not coming to mind. But sometimes folks submit their taxes on a quarterly basis. People also do an estimated earned income statement. Does that sound? I'm trying to think of the name of the document, Kayla. Maybe you can jump in.
Yeah,
here.
maybe I can search for the name of it, but yes, that is generally what it is. It would be an estimate of your.
An estimate of the income that you're planning to earn. And the reason I mention it that way is that when you are applying, when anyone's applying on the individual and family side of the Health Connector, they need to tell us about what they're currently making, but they also need to estimate what they're making for the entire year. So that's why we talk about projected income. And as a small business owner, we understand that could be kind of difficult, right? You're trying to figure out like, okay, this is what I made last year, but that doesn't really mean that's what I'm going to make this year. So I hope that that's helpful.
And if anything, they can always ask a navigator or a sister for more help with those documents, right?
You got it. And I think someone just asked if a profit and loss statement would work. And I think yes, a profit and loss statement. I just couldn't find the words. I'm so sorry.
And we know Kayla's still looking those up, so maybe we can pass that along with our PowerPoint later.
Sounds great. But yes, a profit and loss statement.
I'll drop another link in the chat. It looks like we have a list on our website that would be helpful. So I will just drop that in there.
Thanks
Great,
so much.
thank you.
Nikki or Melissa, can Medicare beneficiaries sign up for dental insurance through the connector?
Yes, absolutely. So I feel like dental plans and dental coverage are the things I talk about the least, so I apologize for that. So yes, if you are on Medicare, this is something Melissa mentioned in the slides. If somebody is a Medicare beneficiary, they wouldn't be able to apply for Health Connector coverage and get subsidies, but that doesn't mean they can't get dental coverage. So we know a lot of folks over 65 are looking for dental plans, and you can, in fact, yes, come to the Health Connector and get that dental coverage.
Great. And so someone actually pointed out, could I review again the one carrier and the one level plan? They seemed very similar. And that's true, they are very similar. The key points between the one carrier and the one level plan that separate them is through the one carrier, the business is choosing what carrier to offer everyone, and then the employees get to choose the benefit tiers within that carrier. Opposite of that, the one level, the business owner is choosing what benefit level to offer their employees, and then the employees can buy across the carriers at that benefit level tier. Does that, Nikki, did I explain that the best way possible to explain the differences between them, do you think?
Yeah, I'm almost wondering if you want to just quickly pull up the visual for them.
Let me see if I can go back really quickly.
Yeah.
So on the screen here, it says under one carrier, the employer selects a carrier. Under one level, the employer selects the metallic tier. So it's really the employer choosing what they are offering as the base, and then the employee is allowing to buy either up and down or across. And again, a broker can definitely assist you with finding out which one is the best for you.
Yeah. And Shayitra, you know what I've always found helpful when you talk about this is that, you know, this offers a lot of flexibility, being able, so if you go back to that slide, I wanted to, stay, go back, I love this one because when we talk to folks, I think, especially now in this, like, I don't want to say post-COVID environment, but COVID environment, and people could have employees all over Massachusetts, right? So if somebody selects the metallic tier, they select the level of coverage for the, you know, them and their staff. Depending on where the person lives in Massachusetts, they could choose to enroll in a different carrier or the carrier that best meets their needs. So I just think that there's a lot of flexibility there.
All right. So we are actually coming up to that 2-minute mark before this ends. So I did want to just see if I could get in one more question or two more questions. What should I do in the application if my income is likely to change this year? I know you want either yourself or Melissa had mentioned to keep the application updated. So how would one person take care of that if their income changed for the individual and family coverage?
Yep. So really quickly, I'd say if you've completed an online application, save your account information so you can go back into your application throughout the year. If your income changes, you want to update your income screens and then resubmit the application. Melissa, is there anything else you'd say, you know, don't forget to do if you get to that point?
No, I think you covered it. Just definitely feel comfortable going into the application. It's really simple. When you go in, just click on edit. You'll get to the page that says report a change. You want to select income. And once you select the income, you'll brought right into the income section of the application right away. And then you just want to enter all the updates there. So yeah.
Okay. And I would say that, you know, any follow-up that anyone has, either for the business side or for the individual side, is all accessible through www.mahealthconnector.org. And again, there's access to find local help such as navigators, assisters, or certified brokers, as well as direct lines to both customer service centers. So we have come up on 1 o'clock, and I'd love to just end this presentation here and remind you that we will be sending this presentation as a follow-up with a link to our survey. Please complete it when you have an opportunity. It will really help us improve our presentations in the future. And I just want to thank you all for joining our webinar today. And from all of us here at the Health Connector, be safe and well. And thank you again for joining us.